Assalamu alaikum. Hi everyone, this is Lara and welcome to my channel Psychology Facts by Lara. So viewers, in today's video we are going to study about schizophrenia, that what is schizophrenia, its types, causes, phases of schizophrenia, mechanism of schizophrenia and treatment of schizophrenia. So without any further delay, let's move towards the topic. So first of all, what is the meaning of word schizophrenia? The word schizophrenia has been derived from two Greek words, and the first one is schism, which means to split, and the second one is phren, which means mind. Collectively, the meaning of word schizophrenia is split of mind. And the term schizophrenia was coined by Swiss psychiatrist Eugen Bleuler in 1908. So, what is the exact definition of schizophrenia? Schizophrenia disorder is a severe chronic disorder and it affects the way a person think, act, expresses emotions, perceive reality and relate to others. So we can say that all the areas of functioning get disturbed by the schizophrenia disorder, and overall reality about the world get totally disturbed, and the perception and the cognitions of a person get totally upset. In a schizophrenia, a person loses contact with reality along with confusing thoughts, images, and sound. DSM stands for Diagnostic and Statistical Manual for Mental Disorders, and it has devised diagnostic criteria for schizophrenia. If a person experiences delusions, hallucinations, disorganized speech, catatonic behavior, and negative symptoms, and these symptoms persist for 6 months, would be diagnosed as schizophrenic patient. And DSM also stated that 2 or more from above 3 symptoms must be present for the diagnosis of schizophrenia. Now we will discuss each symptom in detail, such as delusions, hallucinations, disorganized speech, catatonic behavior, and negative symptoms. First of all, we will discuss what is delusion. Delusion is basically a false belief that is not amenable to change even after providing particular evidences. We can say that in simple terms, if a person form particular belief about particular thing or person, he would strictly stick to it and he would believe on it even after providing particular evidences regarding his false belief. So there are certain themes that define delusions and different types. We can say that these are different themes and types of delusion. The number one is persecutory delusion, in which person think that organization, any group is chasing him and trying to harm him. And referential delusion indicates that person think that every environmental cue, every comment, every one gesture is pointed or directed towards him. And jealous type includes a belief that person think that his partner is unfaithful and dodging him. And erotomanic delusion is a delusion in which person think that someone is in love with him and he is maintaining a secret contact with him. And grandiose delusion indicates person's sense of grandiosity. He thinks that he has exceptional abilities, power, fame and wealth that none other have. And nihilistic delusion indicates a false belief in which person think that any catastrophe would happen and he usually busy himself for the preparation of that catastrophe. And somatic delusion indicates the preoccupation with body and health related issues. Now we will discuss what are hallucinations. And hallucinations are basically false perceptions. If a person experiences any perception in the absence of any stimulus, it would be named as hallucinations. Hallucinations are basically false perceptions in the absence of stimulus. So there are, as we have 5 senses, so hallucinations are related to 5 senses, but the most common hallucinations that are present in psychotic patients are gustatory, olfactory and auditory. Auditory is the most common hallucination that is present in the psychotic patients. And there are 2 other types that define hallucinations, and that are named as hypnagogic and hypnopompic. When a person experiences any hallucination during sleep time, it would be named as hypnagogic. And when a person experiences hallucinations during wake time it would be named as hypnopompic. Now we will discuss disorganized speech. Disorganized speech is a symptom in which person cannot communicate to another person through using a different vocabulary and words, and it has three main types, that is known as derailment or loose association, word salad, and textuality. In derailment or loose association, persons switch from one topic to another topic without forming any logic, and in word salad, person usually try to communicate by using different words and vocabulary, but it doesn't create any sense. And textuality indicates when person answer unrelated, one person answer in unrelated form, which means that he cannot communicate properly, and he cannot answers to the questions, and if he answer, they are completely unrelated. So overall we can say that in disorganized speech, person usually try to communicate but another person cannot comprehend his speech. Now we will discuss catatonic behavior. Catatonic behavior include mutism, stupor, catatonic excitement, and negativism. Mutism indicate a state in which person remain verbally mute. He won't communicate in he won't communicate verbally, and stupor indicate when a person remain in a bizarre and inappropriate posture for several hours, and catatonic excitement indicates when a person do purposeless motor excitement, show motor activity, and that motor activity is purposeless. And negativism indicates when a person show resistance to instructions, he won't follow any other instructions, that would be named as negativism. And now we will discuss negative symptoms. Negative symptoms are only the part of schizophrenia disorder, and these are not part of other psychotic disorders. So negative symptoms include diminished emotional expression. As the name indicates, a person show lack of interest in showing his own expressions, and he express usually less, and reduction can be seen is in emotional expressions. And alogia is basically manifested by diminished speech output. Person usually show diminished speech output, he does not interact properly, even we can say that he cannot interact properly through his speech. And evolution means person overall interest in self-motivated activities usually lack. In this situation, he does not perform self-initiated purposeful activities. And anhedonia means person does not enjoy any pleasurable activity. And the last one is asociality, in which person does not want to interact with social groups or society, and we can say that apparent lack of interest is found in social interactions, and that can be also related with evolution, which means that he won't perform any purposeful activity. Along with that, he don't want to interact with social groups or society, or social interactions won't be recommended. What are the types of schizophrenia? The old DSM-4 has divided schizophrenia into 5 types, such as disorganized schizophrenia, paranoid schizophrenia, undifferentiated schizophrenia, residual type schizophrenia, and catatonic schizophrenia. But in DSM-5, all subtypes of schizophrenia have been dumped because of their limited diagnostic stability. So, what are the causes of schizophrenia? The exact causes of schizophrenia are unknown, but research suggests a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop this condition. Along with that, stressful or emotional life event even might trigger a psychotic episode, and that can lead to schizophrenia. Biochemicals in the brain are believed to be involved in schizophrenia, such as high level of dopamine. Now we will understand the mechanism of schizophrenia. Antipsychotics work by inhibiting dopaminergic neurotransmitters in the brain, and the effectiveness is best when they inhibit 72% of D2 dopamine receptors in the brain. So we will understand the mechanism in general, that how in normal individual and dopamine receptors play an important role, and what is the difference in the psychotic patients. First of all, we have to understand that how message is usually transmitted between two membranes of neuron. First of all, we have to understand that presynaptic membrane of neuron and postsynaptic membrane of neuron usually communicate through synaptic cleft, that is a small gap, and through which receptors or transporters are released and bind with the another membrane, and through which message is transported to the other neurons in simple. But what happens in psychotic patients when high level of dopamine is released in the synaptic cleft, that leads to the psychotic symptoms. Especially or specifically D2 dopamine receptors are involved in the schizophrenia disorder. Now we will discuss the phases of schizophrenia. So there are three phases of schizophrenia. The first one is known as prodromal phase, the second one is active phase, and the third one is residual phase. In prodromal phase, the overall decline in adaptive functioning can be seen, and emotional and behavioral problems starts, and that all the symptoms persist for days and to months. The next is active phase, when we can say that psychotic symptoms appear, that are hallucination, delusions, disorganized speech, and catatonic behavior, and that persists for 1 month or long. First of all, in prodromal phase, we can say that overall adaptive functioning usually get disturbed when a person cannot interact with society, or social interactions declines, and he finds out behavioral and emotional problems, irritability, sleep disturbance. So all these symptoms persist for days and to months. But when when positive symptoms such as psychotic symptoms appear, we can say that it is an active phase and it persists for 1 month or long. Then the residual phase, and we have to remember that residual phase contains the negative symptoms as well. Overall, positive psychotic symptoms that we have discussed as psychotic symptoms usually decreases, but negative symptoms and other distressing emotional, behavioral, and cognitive decline persist, and that can lead to decades. Now we will discuss treatment of schizophrenia. So, antipsychotics is the first and foremost priority that treats schizophrenia. None of the other option is there that can treat schizophrenia at the first stage. So, antipsychotics such as aripiprazole, haloperidol, chlorpromazine, risperidone, olanzapine are the second generation's antipsychotics that are also known as SGAs, and they have different genera or brand names. And a situation comes when these antipsychotic won't work. That situation is termed as treatment resistant schizophrenia, and in this situation clozapine is the most effective antipsychotic that can also manage treatment resistant schizophrenia. Other than that, if in an initial stage of schizophrenia, all these above mentioned antipsychotics can be prescribed. Along with antipsychotics, ECT is very safe and effective treatment for schizophrenia. ECT stands for electroconvulsive therapy, and it is safe and effective in situations where a person shows severe psychotic symptoms along with high level of suicidal ideation. Along with that, psychotherapies at initial stage of schizophrenia are very helpful, and from these psychotherapies, the number one is individual psychotherapy, in which talks are preferred. Usually talks are preferred between client and therapist, and the topic is usually the problems of past and present, thoughts and feelings of a client, how the patient or client discuss about his life, his problems. Usually when he discuss, he get to know about his own problems, about his self. So it's very comfortable and easier way to understand person psyche and how the problems can be tackled. The next one is cognitive psychotherapy, that is known as CBT. CBT is effective as CBT stands for cognitive behavioral therapy. Cognitions that are distorted in schizophrenic patients are changed, and usually the work on cognition is very effective, that can also change the behavior. So overall we can say that the schizophrenic patient harmful or negative cognitive patterns can be changed into healthier and positive ones, and Usually, in this overall psychotherapy session, we can say that therapist's main focus is to create self-awareness and to make the client more confident in order to progress and succeed in the therapy. The next one is cognitive enhancement therapy. In cognitive enhancement therapy, the first and foremost function of the therapist is to make or teach the client how to recognize the triggers or social cues that causes the schizophrenia and how these symptoms create his life worse. First of all, if he would knew that these are the triggers that create a certain symptoms in myself, he would be more able to organize his own thoughts, and that basically creates the person's own ability to manage his own thoughts. The next is psychosocial therapy. In psychosocial therapy, the main focus is to make the individual more safe in a community. He won't feel alone in the community. Along with that, therapy, different social skills trainings, rehabilitation, and family education or self-help groups are involved to help that patient. Sport groups are very helpful. They usually help the people with schizophrenia, and they so that their families won't feel alone, or those families who are feeling alone can be joined and can be given support, acceptance, and advice. Social skill training is very helpful, that basically teach patients to show assertiveness and to overall communication skills are very important to communicate your own thoughts and beliefs. So social skills training is very helpful, and it is totally dependent on the principles of behavioral therapy. When the skills are taught related to disease management or communication skills, the life of a patient gets more better. Thank you so much viewers for watching this video, and don't forget to like, share and subscribe my channel. Along with that, please watch the related video 100 solved MCQs on schizophrenia spectrum and other psychotic disorders, and it is very important video. You must watch it. Thank you.